Welcome everybody to tonight's webinar on COVID-19 and homelessness and the interesting times that we are living in. So we're so glad that everyone is joining us tonight, and we're very happy to have these wonderful panelists from Council for the Homeless, Clark County Public Health, and Clark County Community Services Housing and Development Department. So for those of you who might be new to attending webinars, I just have a few housekeeping items to share with you. Number one, everyone attending the webinar has been muted and your camera and video are turned off, so don't worry about that. The only people that you will see tonight are the panelists and the host, which is myself. You can familiarize yourself with your control panel on your screen for those of you using a computer. It's that orange arrow, orange button with a white arrow in it. And you can use that to show or hide your control panel. And then there is a questions feature on your control panel, and you can use that to ask questions tonight. We are going to have a Q&A portion, so feel free to put questions in there as we go through the webinar tonight. And I will go back to them. I don't want you to forget your questions as we go through. So, and then lastly, the webinar is going to be recorded and shared afterwards. So just a little bit more about that control panel, because it really is something, it's a good tool. You want to get real familiar with that if you can. You can use, again, that white arrow on the orange button to open and close it. You can actually make it so that it stays open if you'd prefer by clicking on the view menu and then unticking the auto hide control panel feature. That might be helpful for some folks. You can use your computer audio by choosing mic and speakers, or you can call in over a telephone using the dial-in information provided. And again, just feel free to submit questions anytime in that questions drop-down box. So moving on, let's talk about our objectives for tonight's webinar. COVID has changed everyone's lives in drastic ways, including people without homes. In a time when we are being asked to stay home and stay safe, practice good hand hygiene, and do things like wear masks to prevent community spread, many are wondering how this has impacted the homeless community and the service providers who help people find emergency shelter and move into housing. So some considerations around health and homelessness before we get started. Pre-COVID, what you see on this slide has been true. And with COVID, this dynamic has only increased and intensified. Some realities of COVID that we are experiencing right now here in Clark County include the following things. Our panelists will talk about some of the ways these factors have been addressed and experienced here locally. We know that people experiencing homelessness are at an increased risk for experiencing severe disease if they get COVID, and that extra guidelines have been issued for people in congregate settings of all types, not just shelter, that additional sites have been set up for people to isolate and quarantine in, that specific considerations have been needed for encampments, that testing has been a challenge, and that this pandemic has shown a very bright light on inequities and inadequacies in our healthcare system. I'd like to introduce Dr. Alan Melnick, Public Health Director and Clark County Health Officer. Thank you for being here, Dr. Melnick. And before we get started, I wondered if you could just give everyone a short update on the COVID situation here in Clark County. I know that's something on everyone's mind.
Yeah, so the COVID situation is actually in the last couple of weeks has actually gotten worse. The number of cases has been increasingly remarkably. The measure that we're using to when we back on June 26th, when we applied for to move into phase 3 of reopening, one of the main metrics is the case count, the number of cases per 100,000 people over 14 days, which was 25, and to really 25 per 100,000 over 14 days. And that would mean to meet that metric, which we did way back in mid-June, you need to have a little bit under 9 cases a day. The last several days, we're up to averaging around 40 or so, I believe over 40 cases a day. We had Friday, Saturday, and Sunday, we had 106 cases, which is about 30, 35 a day. And yesterday, we had, I believe, 47 cases reported to us. So the numbers are going up. Um, our One of the things we look at in terms of disease activity in the community is the percentage of cases, the percentage of tests that are positive. And I know some statements have been made that we're seeing more cases because we're doing more testing. Well, that's not really true. We're seeing more cases because there are more cases. Even though testing numbers have increased, the percentage of the tests that are positive has increased vastly more. So when you see somebody with symptoms compatible with COVID-19 and you test them, it's much more likely now that there'll be a positive test because COVID-19 is out there. The other thing that we're seeing, I don't want to be all gloom and doom here, but I think there are things we can do to protect ourselves. So we can talk about that a little bit later. But the other thing we're beginning to see is the hospital numbers. Earlier in June, our hospital numbers were cases were flat or decreasing. The hospital numbers are beginning to increase. So when we had about 8 to 13 COVID-19 patients in the hospitals, now we're up to the mid to upper 20s of hospitalized patients. So in a variety of ways, things are getting worse. And one of the things we're looking at is why is this happening? And when we look at the data in terms of looking back where people might have been exposed, we're seeing a lot more both small and large gatherings where people are not paying attention to physical distancing and using face masks. We're seeing more of that in terms of where we're seeing cases, including workplace cases. And before I specifically get into the, what you asked me to talk about, you inspired me by your intro to mention that COVID-19, even though it's a communicable disease, like other communicable diseases and like health issues, it really unmasks and makes clear the relationship between the social determinants of health and health outcomes, even with a virus. So we'll talk about housing as a social determinant of health, but things like racism also, we're seeing the impact of COVID-19 in specific populations who are more at risk for based on their race, their ethnicity, and also what their housing situation. These things are all interrelated, but COVID-19 really and also lack of access and based on their working conditions, lack of insurance. But COVID-19 is really highlighting some of the effects that the social determinants of health have on risk and health outcomes. So I wanted to throw that in there as well.
Thank you so much. Okay. So I have a couple questions for you. First, when this crisis first hit, what populations were you most concerned about?
Yeah, so the populations we're most concerned about are high-risk populations in congregate settings, settings where people were together. So, and I'm going to give you a little more specifics about it, but the three populations I was most concerned about were people in long-term care facilities, like skilled nursing facilities, assisted living facilities, adult family homes, the nursing home situations where you had people in a congregate setting and you had elderly folks who are more at risk. The jail population, you've got a congregate setting with people um, who typically have other health risks. And then I want to talk about the homeless, that the unhoused populations. Concerns about that. So, and for a variety of reasons. One is if you're in a shelter, you are in a congregate setting where you're close to folks. Physical distancing is really difficult. In fact, I remember early on we were looking at working with the shelters to make sure that not only the beds were 6 feet apart, but that we actually had people in a head to toe configuration. So somebody in one bed next to the other, the heads were next to the toes of the other person. lack of access. It's gotten better, but lack of access to personal protective equipment, including things like face masks, diminished access to hand washing, sanitizers, even things like being able to properly dispose of used tissues and things like that, particularly a problem in a shelter. Lack of health insurance, lack of access to testing. Testing was originally early on was a big concern. It's difficult in a shelter situation to be able to isolate cases when you do find a case and quarantine their close contacts just by the nature of, you have a shared space and then you have shared bathroom facilities, shared kitchens, things like that. A concern about movement of this population between different facilities, and then um, increased unhoused population is more likely to have other health issues, including medical comorbidities, like, for example, like diabetes and other chronic diseases, and then behavioral health issues. And the other concern about the situation in an unhoused population is that even if they're not in a shelter, they get sick, there's going to be a more of a strain on emergency shelter capacities for folks who are unhoused and who do get sick. So for a variety of reasons, we're really concerned about this population.
Okay, thank you. How have people experiencing homelessness been affected by COVID-19, both directly and indirectly?
Yeah, one of the things, I'm going to go back a little history. You might recall that I believe it was March 18th, the navigation center closed. So that resulted in people losing access to other services. I mean, it was concern about closing it because it was an area where there were concerns about transmission, but that meant people lost access to mail, restrooms, showers, laundry, storage, and even available clothing. I believe the city provided some restroom facilities and some porta potties, but a lot of services were lost there. I think there were concerns about shelter locations with shortage of staff due to fear of COVID-19. Um, the other thing is folks who are unhoused are often working many of them are employed and work in essential services like production facilities where there's people are close together and there's no sick leave, so put them more at risk of infection. Unhoused children who are unhoused lost access to meals at schools. When schools closed, that was a source of nutrition for a lot of children, including unhoused children. So they lost access to that. I believe the school districts and provided some opportunities to pick up breakfast and lunch, but there's transportation issues there as well. So concern about nutrition for kids. And then limited or no access to healthcare for this population. So early in the response, I think hospitals are only testing people who are hospitalized. I know that unhoused people who showed up in emergency departments were turned away because there wasn't testing available, and there were concerns about them returning to shelters and other congregate settings. And this has improved over time. Testing capacity has improved, and local clinics began. I know we did provide work with the Vancouver clinic to provide testing at some of the shelters. So, but loss of access to services and inadequate health care has impacted this population.
For sure. And how has public health helped to support people experiencing homelessness during the COVID crisis?
Yeah, so there's a couple of things we did, and I think Michael's going to and Kate may get into this as well because this involved a lot of partnerships, including Council for the Homeless and Department of Community Services. So we certainly provided guidelines to shelters about screening, temp and symptom screening. We work with the Vancouver Clinic. We used available funding to provide in a number of the shelters, we provided universal testing. And then our assessment staff, we started working on identifying one of the metrics that we needed for the to move through the phases. Plus, we needed this anyway, was to identify safe locations for isolation and quarantine, isolation of unhoused people who are cases, as well as quarantine for those who are close contacts. Shelters are not a good place for isolation and quarantine for the reasons I mentioned earlier. So, there are a lot of considerations we had to have. I mean, certainly people who are in isolation or already cases could be isolated together, but people who are close contacts who are not related to each other, you can't really quarantine them together because they could expose each other if they became cases. So if they were in the same family, we could, but if they weren't, we had some concerns about that. So I remember looking at a variety of settings around this. We looked at space in the Center for Community of Health where our building is. We looked at churches, but they really needed to meet the criteria for isolation and quarantine rooms, which meant people needed to have separate rooms if they're, isolated or in quarantine with access to their own bathroom, and had to have a system where they could basically either prepare food in their room or have food delivered so that they could eat by themselves while they're in isolation or in quarantine. We worked with Department of Community Services. I think they wrote the grant, the Department of Commerce grant. Michael, you can correct me if I'm wrong on that. And got funding. We were able to identify a hotel, Motel 6, with about 118 rooms and approximately 50 of them for isolation and quarantine. The other rooms were set aside for people who are unhoused and not cases or close contacts, but people who are at risk for complications from COVID-19 who are unhoused. And we set up an isolation and quarantine facility there. The other thing that public health had to do with our partners was when you ask people to isolate or quarantine, we're not forcing people. We didn't put ankle bracelets on folks and said, you're now isolated or in quarantine. It was voluntary. And I think when you ask people to do that, you do need to make sure they have access to services. So we worked with the funding and with our partners to establish wraparound services like food, picking up medications at the pharmacy, referral to care, rent and housing assistance for people who are at risk of becoming unhoused, but were being isolated or quarantined, and then transportation as well. We work with our partners to provide staffing at the motel, including security. Peace Health Southwest, their residency program, actually offered to be primary care provider of record for folks who are in the isolation and quarantine facility in case they had any health issues develop. Southwest Washington County Accountable Community of Health is working on providing care coordination for them and referrals. And so those are some of the things we do. On a side note, we also work with the Clark County Council to approve use of recreational vehicles for temporary housing for folks on private property. So we worked on that as well. So a long list of things, but that's how we attempted to support folks who are, experiencing being unhoused during the COVID crisis.
Great, thank you. All right, so now I would like to introduce Michael Torres, the Clark County Community Housing and Development Manager. The Clark County Community Services Department is a vital partner in working to help people experiencing homelessness. Clark County is the primary funder of homelessness services in our community. Michael will share with you tonight some of the projects that the county has been working on. So Michael, could you please tell us about what specifically the county has done for people experiencing homelessness in response to COVID-19? And I think some of this Dr. Melnick touched on already, but if you could expand.
Sure, absolutely. So yes, a lot of what Dr. Melnick said applies. And I'd say some of the stuff that the county has done, which public health has really done, that I don't think Dr. Melnick he could have elaborated a little bit more just because it's so important, is they've really supported providing the guidance to shelters, to the homeless crisis system in terms of, what are the health and hygiene measures that should be taken right now? What are the guidance and support that service providers need to be able to provide services to, the people in our community? We spent weeks working with public health in really on a very short-term basis, boost up the testing in this community so that we'd have the ability to detect, hotspots of COVID-19 and outbreaks and stuff like that. That was bringing in testing equipment to all the medical service providers and the community as a whole. But there was a whole separate process of really making testing available for people experiencing homelessness. So, Dr. Melnick did mention that, when this first started, testing was happening at medical facilities. There was no ability for people that are experiencing homelessness that were symptomatic but did not require hospitalization to go someplace and get tested reliably. There was also no place or no mechanism for homeless service providers, shelter providers, outreach workers that would see individuals that might be symptomatic for COVID-19 to refer them to testing. And even when they got tested, there wasn't a mechanism to do that. And even if that had been possible, then what? There was nothing that, no place for those individuals to go. They couldn't necessarily go back to their congregate shelters. They couldn't go back to an encampment. And we did have, as Kate Budkin mentioned, early in the crisis, there was more than one time that we actually, Council for the Homeless, SHARE, would get a phone call from a hospital saying, hey, here's an individual, they're symptomatic to COVID-19. We haven't tested them, but assume that they have it. You should assume they have it. Do something with them because they should not be in public. Like that happened. And, with the assistance of really hard work from public health, from our homeless service providers, from Council for the Homeless, all those, that structure for testing, for referrals, for transportation to testing, for a place for individuals to go, in addition to the guidance of what should service providers be doing in this new COVID-19 environment, that was set up. So that's one thing that I think, I'm glad community services was a part of in setting up for this community. As Dr. Melnick mentioned, we worked with public health to establish this isolation and quarantine site for people who are unhoused or housing unstable. So where individuals that meet those circumstances of they are homeless or they are close to homelessness, and they test positive for COVID, there's a place for them to go so they can isolate safely without getting anyone else sick, so they can ride it out and get better themselves. So that's big. Same for people who are in quarantine. They can also go to that site. So that's individuals that have been exposed to someone. They don't necessarily have it, but they may have been exposed to someone that's confirmed to have COVID-19. So they have a place to go to basically see if symptoms develop without getting anyone else infected. So that's huge. There are 2 buildings on that site, and one of them is what we've just been talking about to this point, isolation and quarantine. The other building, which is, the whole facility is really about 116 rooms are being used. Half of those rooms are for isolation and quarantine. The other half of the rooms are in an own separate building, and we use that for expanded shelter. And that's expanded shelter of individuals who are unhoused but are at higher risk of death if they got COVID-19. And it could be because of age, it could be because of underlying medical conditions such as pregnancy. But these are individuals that really you don't want, or they don't want to be in a congregate setting, because if they got exposed to COVID, they would be at higher risk. So they can go to this facility, they can have their own room, their own restroom, they can actually physically distance themselves as CDC and public health recommends, thus being in greater safety. It's not individuals who are sick, it's individuals who we don't want to be sick because of the risk. And the reason I'm saying that, and I do think it's important that people know that, not everyone on that site is confined to that site, and they're not infected or sick. And if they leave the site, that doesn't mean they're going to get someone else sick. And they have all the same rights that each of us have. And every now and then we get feedback from people who are concerned that individuals who are homeless or have been homeless and they're at this facility, they're leaving, they might get everyone else sick. No one leaves that facility if they're sick. They stay in isolation and quarantine. But anyway, we helped establish that site. We've also been very, very busy working with the State Department of Commerce in terms of getting more resources to this community to pay for things such as increased rental assistance need because the economic downturn of COVID-19 means there are a lot of people that are having a hard time paying rents, and that's only going to get worse. Getting resources for more flexible rents. Oh.
You there, Michael?
I think you're muted.
There's calm again. Yes, I apologize, everyone. This is actually the best place I can be right now, believe it or not. Another factor of COVID-19 that's unintended consequences. But we've been working really hard with the Department of Commerce to get resources in the community so that service providers have the resources they need to not lose capacity from what we were before COVID-19 hit, and that is capacity like shelter beds, the availability, the funds that are required to be able to continue providing rent assistance that were to individuals that were already needing and receiving rent assistance. So not lose capacity, to add more capacity for the expected increase in the need for rent assistance and housing supports because of the economic downturn of COVID-19. Additional resources to help pay for the loss of volunteers at all our service providers, because a lot of the volunteers have higher risk if they got COVID-19. So a lot of organizations lost some of the staffing that they needed to provide services, and they had to increase the hours of their existing staff. Their existing staff had to be in situations where they themselves were at higher risk. So, have pay increases that reflect that high risk situation that they are in. So we've really been working to get all that into the community. And, specifically, we're talking about the initial outlay of funds for an isolation and quarantine site through June 30th was $1.46 million of Commerce funds. The Board of County Council just authorized an additional $2.6 million to help that site continue in operation through October 31st. We have received $740,000 of Emergency Solutions Grant COVID funds that are be going into rental assistance and outreach and shelter supports. We are putting in an application to the Department of Commerce right now for new shelter programs to increase shelter capacity over what it is right now. That's about $720,000 a year for the next 3 years. We have received about $700,000 of new HEN funds, Housing and Essential Need funds, that will go into rental assistance of HEN qualified recipients. We will be submitting an application by the end of this month to the State Department of Commerce for about just over $4 million was anticipated for prevention rental assistance to help address the increased need that is expected after June 31st with with the eviction moratoriums and just like the economic conditions that everyone is facing right now and their ability to pay rent. So that's the kind of things that we've been doing.
Great,
and again, I
you.
apologize for my dogs.
Don't worry, I'm dealing with the same thing on my end. Two that want to get into my lap really bad right now. All right, so next question. As the county is investing additional dollars that you've just so eloquently described, what what is the lens of focus areas that you're using as you do this?
So honestly, I would say the lenses have really not changed significantly from what they've been pre-COVID-19 for the exact reason that Dr. Melnick already mentioned. You know, COVID-19 has presents a lot of challenges to our community, but it has really it has highlighted the inequities that are already there and already exist. So, you know, for example, the economic downturn caused by COVID-19, the homeless crisis response system, the service providers, the people that they are going to see are those that were closest to having instability, whether it be housing instability or low incomes, limited job prospects, just those difficulties are just exacerbated by the economic downturn. The medical inequities in terms of healthcare, that's exacerbated as well. The availability of housing, you know, the same kind of thing, whether you're talking about being able to afford housing or, you know, getting screened into housing. So in our contracts with all our service providers, because the county doesn't provide services directly on the most part, what we do is we provide public funding to our local service providers that give services. So in the existing contracts, we actually have a lot of requirements in terms of the program design, of the interventions that we're funding and the service delivery. And the things that we ask for is we ask service providers to provide an equity lens. And by that, I mean the service providers seeing who is being served and who is not being served. How does that compare to the population as a whole? Trying to understand where there are disproportionalities to be able, and we see that, try to understand how they happened and what could be done about it. So, you know, we're asking service providers to do their best so that their boards reflect the communities, their staff of those service providers as much as possible reflect the people that are being served. That the people that are being served truly reflects everyone that is in need of that service in the community, not just the ones that are most visible or most accessible. We are asking service providers to deliver services in a client-centered way as much as possible. So that means someone receiving the supports that they need, not just a cookie cutter approach of the supports that are available, and that they have to adapt to that and make that work for them. Like, as much as possible, you want to see individuals, see households, understand the crises that they're in, provide the supports that are tailored to their specific situation, and help them achieve stability and succeed. So that's what I mean by client-centered approach. As much as possible, we've been asking service providers to use a harm reduction lens in the services that they provide. And that means helping people access the supports that they're able to access because they need that support, not necessarily because, you know, to as much as possible, not having to do anything unnecessary to access that support. That could include things like, where it's possible and appropriate, lowering the barriers to shelter so that you can go into shelter because you need shelter. We've asked service providers to apply a lens that is trauma informed, meaning that we understand and we see that the individuals that are coming for services, they that experience, the crisis is traumatic. That we don't want to add to that trauma by putting unnecessary barriers to receiving those services, providing supports that truly are customized around them, and they're compassionate, and they understand where those individuals are. And we've also asked service providers in all our contracts, to the greatest extent possible, to have a lens that is strengths-based. That when individuals come and need supports and services, you don't look at those individuals and see the weaknesses or the crisis, the gaps that they have, but see what are the strengths that you have that will help you achieve the stability that you need and succeed in the future. So, those are the things that we've been asking in terms of lenses for our service providers. Some of it, we're not, it's not even some of it. In general, we're not doing these as edicts just in contracts. We've been, these are partnerships with our service providers. And I must say, we haven't had any pushback or resistance in any of those requests for those lenses. We've generally had a lot of enthusiasm in moving forward. And if we look at Council for the Homeless in 2018 and 2019, you guys have been working on the equity report to the community for the homeless programs that we fund, that we publicly fund. That's something that, I look at that report and I look at it as something that has been produced in partnership. And you're looking at the homeless management information system data that all our publicly funded service providers that go into the homeless system, they're seeing the people that are being served by the system, looking at the disproportionalities, looking at the inequities, looking at the successes, and trying to understand it and do better moving forward. So, that's the kind of thing that's happening because in this community, because of these lenses that we're applying.
Yeah, indeed. Thank you. I think those do reflect a lot of the specific values of the agencies that you partner with. So thank you so much. Okay, so now I would like to introduce Kate Budd, Executive Director for Council for the Homeless. Kate is going to share some information about how the homeless crisis response system has adjusted and how it continues to serve people experiencing homelessness during the ever-changing landscape of COVID-19. So Kate, what are people experiencing homelessness saying are their biggest challenges?
Sure, Laura, thanks for the question. So I want to share that I know for myself that COVID has certainly increased the stress and the anxiety that I have in my everyday life. I know that that's the case for staff that I work with, and I imagine it's the case for all of you that are here on this webinar and our panelists. The fact is that for people who are experiencing homelessness, this same stress and anxiety exists for them due to COVID as well, but it's only on top of all the stress and the anxiety and the trauma that Michael talked about that already comes with either being unsheltered or being in a shelter or living in a car or living in a motel. It's very difficult to experience homelessness. And COVID has only added another layer of stress on top of the already challenging reality that folks deal with. And so we were talking these past few weeks with folks that my staff work with at the Housing Solutions Center who are experiencing homelessness, particularly those who are unsheltered. And when we asked them what they would like us to share with those of you on this call, a few things that were really highlighted was one, that their ability to access basic needs, so laundry, showers, restrooms have been greatly restricted during COVID. The fact is that the majority of their go-to locations, whether it's the navigation center, whether it's the mall, the library, a local restaurant that they might stop into, get a drink and use the restroom, they're all closed. And so that access to the very basic needs that we all depend on just isn't there. And that alone adds great stress and anxiety. And particularly so if there are community members who are very fixated on someone, not meeting their basic needs in their space. And the fact is that, it's understandable. There are things that folks, ought not do, in the light of day, but sometimes they have no options. And so that's an opportunity for our community to continue to work on. We were very fortunate to have Washington Recovery Alliance open up the Fourth Plane Pit Stop at a church that's close to the Navigation Center, which helped to meet those needs for a portion of the COVID crisis. And we certainly appreciate Jamie Spinelli and the Recovery Alliance for all their work and their volunteers. We also appreciate Living Hope Church for opening up to provide food as well as resources and fellowship to people experiencing homelessness 4 days a week. And that helps folks be able to meet their needs. We also had the Navigation Center, who continues to open up Tuesday and Thursday from 10 a.m. to 12 noon to allow people to access their mail that might be sent to the Navigation Center, as well as anything that might be in storage. And so at least that continued the lifeline for folks who relied heavily on the Navigation Center. Other feedback that we received from folks who are unhoused includes the fact that they just don't have a place to be. Again, they used to go to the mall, to the Navigation Center, and that just isn't an option right now. And so they often said, if you see someone and they're in a place where, it's okay for them to sit and be for a little while, please just let them be. A smile goes a long way, but they really don't have a place to go to or a better place to be. And if for some reason they can't be, in one spot, maybe it's your property, share with them where they might be able to move on. Because again, no one can walk around a community 24/7. And right now, today, it is realistic that there may not be a shelter space available for someone. There are far fewer people right now who are experiencing homelessness and compared to the pre-COVID time, particularly in thanks to the county's expanded shelter efforts at the Motel 6, as well as to SHARE's expanded shelter efforts. But again, there is a limit to the number of beds and motel vouchers that can be given. So there are definitely people who are unhoused right now in our community, as many of you are well aware. Another phenomena that we're seeing in the community is an extreme increase in the number of people who are experiencing domestic violence. As you can imagine, whether you are housed or unhoused, all of the stress and anxiety of COVID can lead to dangerous situations. And so we are hearing that folks who are living outside are getting into more fights, couples are splitting up, folks are needing to put space between themselves. And we're also seeing that with people who are housed, that they may have been living together, in an okay situation pre-COVID, but suddenly when you're spending 24/7 with your partner and your kiddos, and you're trying to homeschool, and maybe you don't have the income coming in that you previously had, domestic violence unfortunately may occur. And so we're very fortunate in the community to have the YWCA to help address that. We also have their Safe Choice Shelter, which can serve people experiencing homelessness. But again, that space is limited, and those who are fleeing domestic violence situations are indeed defined as experiencing homelessness and can access the resources that exist in the community. And unfortunately, we're seeing the number of those folks increase significantly. We had a number of people just want to share how difficult it is to homeschool kids. When you're living in a car, or when you're living in a shelter, or when you're living in a motel, it's just next to impossible. We had a mom say, it's hard enough just to keep my children safe and fed. The idea of trying to provide them with an education, especially another mom who shared, I didn't have an education, is just next to impossible. And so just share that, and I think it's certainly something to ruminate on. We also have seen, as well as heard anecdotally, that we're seeing more youth experiencing homelessness. And this is something that's very logical as well. You have families who are spending 24/7 together who previously never had, and there might be some type of challenging family dynamic. And so youth are either fleeing their home, they might be getting exited from their home, they might be, just feeling like there's a safer place to be outside of their home. And for some youth, the safer place is on the street. And so we are seeing the number of youth, really ages under 24, increase within the community during this COVID crisis. We're also hearing that because folks are focusing on survival, especially those who are unsheltered, it is more difficult to focus on staying safe for COVID. And so a lot of people experiencing homelessness, they roam around town with their family, which often is a family of choice. That may include very good friends or partners or mentors, folks who have been taken under their wing. And those folks are really focusing on meeting their needs, and feel strongly that they should be able to be considered a family and not have to wear masks together because they've been together during this entire COVID crisis. And so that's also something to think about, that if you see a group of people who are experiencing homelessness in the community, and you don't see that they have masks on, consider that they may be a family of choice, and that they may be, have basically lived unhoused together for a very long period of time, and would indeed mask up should someone new enter the area. And so respect them just like you would, respect a more traditional family, has been an ask of them. So, the fact is that this is very challenging for everyone involved, and that the more grace we can provide, the better. And then the more resources we can provide to help people meet their basic needs, also much better in helping everyone remain safe in the community.
Great, thank you. All right, so we're a little over time. So if we could maybe quickly move through a couple more questions, and then I'll move into some audience Q&A before our time is up tonight. So are there any specific ways that you would like to talk about that haven't maybe already been touched on, that the homeless crisis response system has continued to serve people during this time?
Sure. So I had mentioned that Share had increased their capacity in Share House. So they have folks who are sleeping in their cafeteria, which increases the number of single men that they can serve. Enormous thanks to St. Andrew Lutheran Church and Share for being able to keep the WHO at St. Andrew open from the end of March all the way through the end of June to be able to serve additional households. We want to thank the city for providing funding to allow the Women's Hospitality and Transition Shelter at St. Luke's to be open 24/7. It had previously only been open at night, and that helps single women with high needs be sheltered. We want to thank the city as well for allowing St. Paul to remain open after the WHO closed at the end of March, as well as for opening up tent encampment through Living Hope Church in partnership with the council as well as Living Hope, so that at least 20 individuals, and I heard recently there were 29 individuals who were sheltering in place there at that encampment. We also have seen a significant amount of increase in food availability, which is significantly helpful. Those who are living outside have fewer access points for shelter. Primarily, it's Living Hope Church and Share House to be able to access food. And so the food bank has been helping to supplement that in many different ways. Also, thanks to St. Vincent de Paul, Vancouver conference for providing laundry tokens to people so that they can access laundry services, particularly because there's no other laundry options in the community. And so it's been an amazing community effort. And I just can't thank all of our agency partners, our faith communities, as well as our governmental partners for helping to increase the capacity and helping to be able to meet the basic needs of people experiencing homelessness.
Great. Thank you. Let's see. And lastly, I do think this is something that people would like to know more about. How has public money and private and community philanthropy played a part in the homeless system's response to COVID-19? I think everybody tonight has sort of touched on it, but it would be nice to sort of focus on that for just a second.
So I think this is another example of why we live in such an amazing community. When the pandemic hit, many of our agencies and faith communities and even governments were presented with opportunities for resources to access with very few strings attached, recognizing that the need was rising and that there were ways we could all work together to be able to meet that need. And so the Community Foundation, for example, with the creation of their COVID Emergency Response Fund, was invaluable and continues to be invaluable in helping local agencies and faith communities meet the need that is here in the community. So, for example, they've provided significant resources to help meet basic hygiene needs. They've provided food resources, I know, to the Clark County Food Bank and many other agencies. They have helped to provide culturally specific services. As Michael mentioned, we know that marginalized communities are greatly harmed by COVID at a much larger rate than other populations. And so what that means is we also want to make sure that the resources are supporting them in a much higher proportionality. And so they've been very thoughtful in the way that they allocate funds to make sure that communities who have the highest needs are receiving the greatest amount of their resources. And so many thanks to the Community Foundation for that. Also, just appreciation for CRESA and the state of Washington for providing enormous numbers of masks for folks who are unhoused and experiencing homelessness. If anyone out there has a group or an agency that's in need of additional masks, feel free to reach out to Council for the Homeless, and we'd be glad to connect you with the masks that we have to share so that we can get more in the hands of people who are experiencing homelessness. And then just lastly, to the governmental entities for working just as hard as the nonprofit and the faith communities to get the dollars out as quickly as possible. This is a very busy time. We can't appreciate them more for their partnership and for their ability to move very quickly during this time of crisis.
Great, thank you. Okay, so we're kind of a little short on time here. I do want to get to some questions from our audience tonight. So I think I might save this question for the very end if we have time. But just a reminder, you can submit questions in that questions box. I've got a couple that have come in through the night so far. Number one is about rent assistance and how specifically people can access that. You know, like specific advice about where people can go to access rent assistance.
Sure. So right now, there are a number of agencies that have rent assistance available. The need for rent assistance today greatly outweighs the resources that exist. And the best thing that I can suggest to anyone who is looking for rent is to just continue to try. Mostly it's by calling. So for example, the Council for the Homeless, we have rent assistance, and folks can call our housing hotline at 360-695-9677. There's a specific line for rent assistance. You'd call and then find out if there's any available at that specific point in time. The Salvation Army also provides rent assistance, as well as all the St. Vincent de Pauls in the community. Clark Public Utilities, through their LIHEAP line, also provides limited rent assistance for up to 1 month. And for all of these details, the Council for the Homeless actually has a COVID website that you can check out, and there's a tab specifically targeted to rent and utilities. Check that out, particularly if you're someone who is outside of the city of Vancouver. The St. Vincent de Paul conferences have been reporting that they have not seen an enormous increase in rent assistance needs. So we want to make sure that they're being utilized well.
Great. Okay, how about can you provide more information on how, on how many people identifying as homeless tested positive for COVID-19 since March?
I know that in terms of when we did our shelter testing, we didn't identify anybody in the shelters who were positive. But I don't have the data in front of me right now, and I'll go back, and I know we've had, well, actually, I should mention this. I know we've had a few people in isolation. I'm trying to think of the exact number. It's been a small number, fortunately. I think at any one time since we've had the isolation and quarantine motel open, we've had 1 or 2 folks in there. But right now the total number, I apologize, I don't have that for you.
Okay, yeah, thank you.
Share, if I may, that even the majority of folks going into the quarantine and isolation side have been from locations where they're not able to effectively isolate, like a congregate facility. And so we're very fortunate in this community that the number of people who are unsheltered has been extraordinarily low. And I very much would like to credit that to those who are unsheltered, and the fact that they are being as safe as they can, that they are physically distancing outside of their family of choice, and that they are masking up and using hand sanitizer and accepting these basic need bags that the outreach teams are providing to them in order to help them remain safe.
The other thing I want to add to that is somebody may ask, well, why do you have all these isolation and quarantine beds available? And first of all, we need them to meet the state metric, but also it wouldn't take much to have a large outbreak. You're dealing with a congregate setting. We can't go without having those beds available, because we can't predict when we'll need a large number of them, because, as I said, in terms of my concern about the unhoused population, we can get an outbreak spreading pretty quickly. Once we have 1 or 2 cases in a shelter, it's certainly a concern. So we need to have those beds available. You can't just create an isolation and quarantine facility overnight. It takes a lot of preparation, and of course you have to find a motel willing to do that. So there was a lot of work that went into that, but that's not something you could create on demand. So I want to make that clear.
All right, thank you guys so much. Unfortunately, I think that's all the time we have for questions now. We're coming right up on 6:30 here. We do like to leave you with a community call to action. So first of all, I think unlike homelessness, racism has existed for hundreds of years, and we're not going to end homelessness without addressing systemic racism. Nationally, 40% of the homeless population is Black, but they make up just 13% of the general population in the United States. Housing injustice is inextricably linked to systemic racism, and racism especially permeates healthcare and housing. and waiting right at the intersection of this is COVID-19. So if we're serious about ending homelessness and achieving health equity, we must center racial justice in our work. People with very low incomes struggle to afford to live in Clark County. And advocacy is needed like never before. If you would like to get involved, you can sign up for our housing advocacy emails, and we will provide opportunities to engage at a local, state, and federal level. You can share resources if you're able. Our COVID resource page on our website has resources for people impacted by COVID-19, including rent assistance and other supports for people experiencing homelessness. You can volunteer, donate, and advocate. And you can bust stigmas. If COVID has taught us anything, it's that a cycle of poverty, poor health, lack of income, and lack of affordable housing are huge factors of what causes homelessness. And lastly, be kind. It's contagious, and that's the one thing that we can all agree is good to spread and catch right now. We hope to see you again in just 2 short weeks for our webinar on the eviction moratorium expiration. And I did see some questions in the chat about the anticipated wave of evictions once this moratorium ends. So this hopefully will be a good opportunity to learn more about that. We'll have our partners at the Clark County Volunteer Lawyers Program joining us and hopefully provide some good information. The moratorium on evictions in Washington is set to expire on August 1st. So this will be an opportunity to talk about that and sort of next steps going forward. So thank you again, everybody, for joining us tonight. I will let you go enjoy this nice, lovely, warm summer evening, and we hope to see you again in 2 weeks. And thank you so much.